Hey everyone, and welcome back to the channel. Today we are tackling a subject that is a concept you need to master, and that is alcohol abuse and its impact on the body. In awareness of Alcohol Abuse Month, or I believe it's Alcohol Abuse Month or Substance Abuse Month, something like that. This is a presentation or lecture regarding that. So this isn't just about memorizing facts. It's important that you understand the why behind the clinical presentations of someone that presents to you with alcohol abuse symptoms. So let's get into it. All right, let's get down to the cellular level on this. What's actually happening in the body with chronic alcohol abuse? Think beyond just liver damage. So there's the brain, right? The brain on alcohol. The alcohol is a central nervous system depressant. So we know this. So if you drink chronically, then there's going to be some neurotoxicity. There's going to be some neural damage that's going to be happening. You want to think about what happens when you have neuronal damage. There's going to be impaired neurotransmission, structural changes. They might present as being slow in their actions, slurring their words. The key takeaway for this is that it's not just about being drunk, it's about long-term neurological consequences. So the next organ that it's going to affect, when we look down the line, it's going to be the liver, right? That's the detox hub, and it's going to become overwhelmed. You're going to get fatty liver symptoms leading to hepatitis, leading to cirrhosis, which is fibrosis and impaired function when it comes to the liver. The key takeaway for that is that it's going to be progressive. It's going to be irreversible damage affecting vital metabolic processes. Then we go down to the GI system. There's going to be irritation, inflammation, gastritis, esophagitis, some malabsorption, and then overall, it's going to impact nutrient intake and overall health, so you might see some weight loss there. Cardiovascular. Cardiomyopathy can be a result of alcohol abuse. So you may have a weakened heart muscle, arrhythmias, hypertension, but the key here is to note that there is a direct toxic effect on the heart. Now let's consider who is more vulnerable. Understanding these risk factors helps with early identification and preventative care. So we want to think about biosocial, the risk factors. So biologically, is there any family history of alcohol abuse or early age drinking? We want to talk about the predisposition and developmental impact. We want to look at that. We want to look at their psychological. Is it co-occurring? Do they have other comorbidities in the mental health category? Is there co-occurring mental health disorders? Is there any anxiety, depression, self-medication? There could be a dual diagnosis there, which will require integrated care, both in the medical and psychological side. And then there's the social constructs. There's the peer influences, the cultural norms, and we want to know about their environment. So we want to know about their environmental context because it matters. Now, time to sharpen your assessment skills. How do we recognize the signs and symptoms here? That's what we need to think about. Think holistically. It's not just about the smell of alcohol, right? So in signs and symptoms, we want to categorize things because we want to be able to recall them better. So behavioral, we want to think of loss of control, right? They're addicted to this thing. They're drinking more than they intend to drink. They're unsuccessful at attempts to quit. They have a significant time spent drinking or recovering. They have cravings. So we want to look at impaired self-regulation when it comes to behavioral. So the next category will be social or occupational. Is there problems at work, school, in their relationships? We want to know, is it due to alcohol? That's the key. And giving up Or do they have a problem giving up activities? Are they giving up some of the activities that they enjoy? We want to know about their functional impairment in this category overall. Now, physically, we want to know about their tolerance. Do they keep needing an increased dosage of alcohol, or do they increasingly need more and more alcohol? Do they have withdrawal symptoms? Do they have any tremors, any nausea, any anxiety when they stop drinking? And basically, we want to look at their physiological dependence. So here, let's put on our nursing caps and walk through the nursing process. This is your roadmap for providing patient-centered care. Okay, so let's do our ADPI. We want to keep it action-oriented, basically. So in the assessment, we want to do a comprehensive history, looking at their drinking patterns, any comorbidities. We want to do a physical exam, look for signs of liver disease and any neurological changes, and assess their mental status. Use screening tools, audit, CAGE, and the key takeaway here is to gather objective and subjective data. In the diagnosis area, what you're going to see, the MD order is going to be, they will be diagnosed with alcohol use disorder, most likely, and the nurse's role is to provide the assessment, which will influence what types of orders are inserted into the patient's chart. So when it comes to labs, we'll make sure we're looking at our LFTs. Planning, we're going to do individuals' goals based on that specific patient. We could say up to sobriety. We want to reduce the risk of harm to this patient, involve the patient in goal setting, things like that. But when it comes to implementation, we definitely want to make sure that we're educating the patient about the disease process and coping mechanisms so that they can cope with any types of depression or anxiety that may be going on in the background. And we just want to empower the patient with knowledge. And then we want to give our medications. So what types of medications would be needed? Anything for withdrawal management, so benzodiazepines. We want some medications on there to prevent any more cravings, so that will be your naltrexone, your acamprosate, that's another one. And then the basic thing we want to do is understand the rationale behind the medications that are given. You might have some Ativan on there depending on how anxious the patient is or if they're getting violent. You want to make sure that they have referrals upon discharge. You want to make sure that they are in contact with an AA meeting or going to some kind of therapy group for support. You want to provide therapeutic communication throughout, motivational interviewing. Do not ask leading questions. Adjust the plan as needed. And now it's time for an NCLEX question. A nursing student is caring for a patient with a history of chronic alcohol use admitted for pneumonia. Which of the following assessment findings should the student prioritize and report immediately to the supervising nurse? Mild diaphoresis and a heart rate of 98 beats per minute, reports of feeling anxious and having difficulty sleeping, new onset of confusion, disorientation, and visual hallucinations, intermittent fine tremors in the hands. select your answers, please. If you selected C, you are correct. New onset of confusion, disorientation, and visual hallucinations. So, here's the rationale. Pause this video and read it for yourselves. So now that you have a solid foundation on what alcohol abuse is all about, pathophysiology, risk factors, and symptoms, from the cellular damage to the nursing interventions, just remember, this is about compassionate, evidence-based care and keeping a patient safe. Keep asking questions, keep learning, and you'll be well equipped to make a difference in this world, and in patients' lives. So thanks for tuning in. Thanks for watching. If you found this helpful, please give it a big thumbs up, like, share, subscribe, do all of those things, and I'll see you in the next video. Bye.